We are now seeing a lot of patients following massive weight loss. Most of them are following bariatric surgery procedures. Some of them are spontaneous weight loss by very rigid diet and exercise schedule. You must understand what the deformity of massive weight loss involves. The skin has already been stretched beyond the physiological limit. Now, when you do a liposuction on such patients, the skin has lost its ability to retract, which means that following massive weight loss, it is almost always an excisional type of surgery. When I say excisional, I mean removal of large amounts of skin. What are the areas it affects? It affects the breasts, the arms, the upper body, the back, the waist, the tummy, the hips, the buttocks and the thighs. Because when tissue is emptied of fat, it is going to sag. Gravity is the greatest enemy, it is going to sag. Ideally, what we are left with is empty areas which have been completely devoid of fat, which we are now dealing only with skin excess. Now here's where there is a very common misperception of patients. When the descent occurs in the lower trunk following massive weight loss, it descends like, imagine a lampshade, a lampshade. It is narrow on top and broad below. This is how the descent of skin and tissue occurs. So a simple tummy tuck is not going to work for the simple reason that there is a 360-degree laxity of skin. This is something that must be understood. Only doing a tummy tuck is not going to address the laxity of the flanks, it's not going to address the laxity of the descent of the buttocks and the loose skin around the waist. So almost all these patients who have had significant weight loss following either bariatric surgery or otherwise need what is called as a belt lipectomy or a lower body lift. These terms are frequently used together synonymously, but there are some minor differences between the two. In other words, you need to pull up the lower body as a whole and you will have a 360-degree scar. Anything short of this is a compromise. Of course, if the patient says, I don't want a 360-degree scar, I'm willing to accept the fact that my buttocks are still have dropped and they have not been raised, we can accede to their demand provided they realize what they are going in for.